morning. This is your Houston chiropractor, Dr. Gregory Johnson. We have Val back with us today for his third treatment on his hiatal hernia condition. And y'all missed the ring dinger on him yesterday evening, so I thought I'd do that today for all you ring dinger fans. And you can see he's kicking before. And this is his second one. He is sore right down at the L5-S1 junction, which is very common and normal. Okay, breathe and relax. There you go. Oh yeah. Yep. Feel that all the way down?
Yep.
Yep.
You okay?
Oh yeah, he's okay. Still kicking. All right. It's tender at first because we're breaking up fibrotic adhesions and scar tissue formation in and around the joints, the disc, and the synovial joints of the facets and zygapophyseal processes of the lumbar spine, which is how the facet joints are referenced in the lumbar spine as zygapophyseal joints. Yeah, so while he's on this table, check his leg length is even today. We're going to adjust his lower back from this end. Did you feel that all the way up?
Yeah.
How about that one?
Yeah.
Okay, good. Now, let me help you up sideways here, Val. Bring those legs over like that. Yep. Then we're going to come over here on our new BioPhysics table and have you lie on your tummy with your face right in there. Get this turned on this morning. Okay. So, yesterday when we first checked Val, his right leg was a 1/4 inch short. Today it's exactly even. And it stays even. I bet that tightens up a little bit though in your lower back. Yep. So we're still going to start off adjusting his sacroiliac joints. Get the right one first. The sacrum right in the center, and we're pushing that straight away from L5. Sacrum on the left. The left SI joint. Then I'm going to go back to this right one there. And now we're going to work right up into L5. Right there. L4. L3. L2. Now these drops are a lot more substantial than I was able to do with that other adjusting table that dropped. And I'll be able to do a whole lot more in correction of the entire spine, especially the cervical spine, with this new table and the cervical drop pieces and maneuvering that it allows me. There we go. Okay, just let the shoulders relax down. There you go, good. One more right here. Yep. Okay. All right, Belle, take some deep breaths. Wake up in the morning. Sound like an Irish bartender here. As you can tell from Val's happy feet here, this is a very deep myofascial release tool that we utilize, and we want to stimulate the somatovisceral reflex when we do this, which will help his hiatal hernia, his stomach, and diaphragm. Well, that's tender right there, huh? And he'll be seeing Joseph after this. Joseph's a lot nicer than I am with his elbows. Wouldn't you agree, Val?
Oh yeah.
Yeah. This is kind of like when you're talking to patients when they're facing down here and I got my elbow in their spine. It's kind of like going to the dentist and trying to talk when they got that instrument in your mouth. Okay, Val, let's slide down just a little bit. There you go. Now you're going to feel your head piece popping up here. So with this, I am putting the cervical curve back into a forward lordosis. Right there, C5-6, that was excellent. Now I'm going to go all the way down to T2, right there. That's probably the most tender one. Okay, now I'll be nice for a minute. This will increase the circulation into the tissues and bring blood flow in to bring oxygen and nutrition into the cells, as well as help the blood carry out the metabolic waste products of just normal cellular metabolism. Okay, Val, let's turn you on your back now. There we go. Okay. There. Okay, now we're going to adjust the zygomatic process here, and I'm going to put, again, the cervical curve back into his cervical spine, the cervical lordosis that you're supposed to have. And by contacting the zygomatic processes and pushing the head forward and then rotating it backwards on the x-axis or extending it, we help to increase that cervical lordosis. Now I'm going to have you slide down just a little bit. And now we're going to adjust his upper thoracics and his shoulders. If you can put your arms out to the side for me, Val. This is my Jesus adjustment. There we go. They're all Jesus adjustments. There. Now Val's had some issues with his xiphoid process down at the base of his sternum, sticking out a little bit. And before, when we first evaluated him, you saw that his rib cage was an inch lower on the right side, and was also sticking out more on the right side. And as you can see, that's evened out quite a bit from the first time. And now we're about a half an inch lower, so it's getting better. We're still going to adjust that up though. And you got to be careful down these lower ribs because they are cartilaginous. So right here at the end of his sternum is a xiphoid process right here. And it's tweaked off a little bit to the right. So I'm just going to softly adjust it back over by torquing it. There we go. Good. And then I'm going to come over here and get down below his xiphoid process and pull his stomach down. You can rest your hands up here now. Val, take a deep breath in, please, sir. Let all your air out. And just keep exhaling. Now this is Val's third day of doing this, and it's already down better. It wasn't up as high as it was yesterday. That wasn't as bad, was it? Another deep one. And we taught his wife how to do this yesterday. And she did it on him last night after they ate dinner, and he got that full feeling, that bloated feeling that most hiatal hernia acid reflux patients get. And it's okay to do that after you've eaten, and if you start feeling that bloated, full feeling and that pressure, have your spouse pull that down, and just make sure I show them how to do that properly, because you want to stay off of the liver and the gallbladder. Okay, excellent. So I'm just going to check your knees here. Yeah, that's good. You should have felt that one in your low back too. Yeah. Okay. Try to get rid of some of that soreness now with Joseph afterwards too. Okay, got another one here. That wasn't all of that one. There we go, better. Okay, now let's have you sit up and face that away, please. There we go. There's his right shoulder. His left shoulder. Elbows are pretty good today. Wrists are pretty good today. Yeah. Good. Okay, good. Now Let's come over here and stand in front of the mirror. Somebody left a comment about wanting to know what I was doing with this clicker gun. This is a Atlas specific adjusting instrument, posture corrector. And what I'm doing is I'm adjusting the Atlas on the x-axis, which sends a neurological barrage of information into the cerebellum. The cerebellum controls balance, posture, coordination, and all kinesthetic movement throughout his body. So we're going to put him in a mirror image, so flex your head forward and backwards for me, Val. Much better range of motion already, though. Take a look in the mirror right now. So your chin's up and your shoulders are more square than they were yesterday.
All right.
But you're still a little bit right here and you're still a little left down here. So let's pull these guys up and back. So we always put the patient into a mirror image, and this is his therapeutic exercise as well that he's doing at home 15 times. Shift weight to the right. There you go. Now lift the ceiling. You'll feel a little tap right there. And another little tap right there. This is also known as neuromuscular re-education because we're stimulating the vestibulocochlear apparatus in the medulla oblongata in the cerebellum. Okay, relax. And let's try that same thing again. Now that's already better. That was smoother that time, wasn't it? Yep. Take a look in the mirror right now. You're square as can be right now. Right down the middle. Should good. So Val, would you mind sharing with our YouTube subscribers and viewers, this is your third treatment, and you usually have problems more in the evenings, you told me.
Correct.
A couple hours after you eat, but you
Correct.
said you did about 70% better last night?
Exactly. So I had my dinner last night and I felt much better. Not fully, but this is only my third treatment, and this is really intense. It looks actually
Easier on
easier.
YouTube, huh?
Correct.
Deeper
But
in person.
It is deeper, right? So it's really intense and it's really good.
But has it been worth your trip to come down here from New Jersey?
Absolutely.
Because a lot of you people out there watching these are said you've been watching them for years or months or however long you've been watching them and trying to make the decision should you come here. Well, you got to just really kind of jump on the plane and get over here to find out for yourself, because you can't find out over the internet. And I can't tell you whether I can cure you over the internet or help you over the phone either, so don't ask. All right, this is your Houston chiropractor, Val and Renee and Joseph, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.